Hello, welcome back. Today, in this video, we are going to learn the ulna. Ulna is the medial bone of forearm. We start with the side determination. How to identify the side of the ulna? You can see the rounded head at the lower end of the ulna. Upper end of the ulna is hook-like, and the concavity of the hook is directed forwards, and you can see there is a sharp border directed laterally. Now look at the bone and identify the side of the bone, and please do comment below. The upper end has got two processes. So here, this is the coronoid process and this is the olecranon process. And between the coronoid process and olecranon process, there is a notch known as the trochlear notch. This trochlear notch of ulna is articulated with the trochlea of the humerus. So here we have the lower end of humerus and you can see the trochlea, and this is a trochlear notch. The trochlear notch of ulna articulates with the trochlea of the humerus to form the humero-ulnar joint. Here is olecranon process. This olecranon process has got five surfaces. So we have the superior surface, the posterior surface. Here is a medial surface. The other side we have the lateral surface, and this is the anterior surface. This olecranon process projects upwards from the upper end of the shaft of ulna. This is the superior surface. Triceps muscle is inserted onto the superior surface, and to the anterior margin of the superior surface there is attachment of capsular ligament. Okay, here comes the anterior surface. The anterior surface forms the upper part of the trochlear notch, and we have the posterior surface. Okay, this posterior surface, it's a triangular area. Okay, and there is a bursa related, and this bursa separates the posterior surface of olecranon process from the skin. The upper part of this posterior surface forms the point of elbow. This is the medial surface. The upper part of the medial surface gives origin to flexure carpi ulnaris, and the lower part of the medial surface gives origin to flexure digitorum profundus. And ulnar collateral ligament is attached to its upper part. Okay, that is ulnar collateral ligament is the ligament of elbow joint. This is the lateral surface. Okay, Anconis muscle is inserted onto the lateral surface. Okay, so that was the olecranon process. Now let us see the coronoid process. This is the coronoid process. Coronoid process projects forward from the shaft just below the olecranon process. Okay, it has got four surfaces. We have the superior surface, we have the anterior surface, then there is a lateral surface, and there is a medial surface. Okay, then the superior surface forms the lower part of the trochlear notch. Anterior surface, at the lower corner of the surface there is a ulnar tuberosity. Ulnar tuberosity gives insertion to brachialis muscle. Medial margin of the anterior surface is sharp. Okay, and the sharp medial margin of the anterior surface provides attachment to anterior band of ulnar collateral ligament, oblique band of ulnar collateral ligament, lower part of humero-ulnar head of the flexor digitorum superficialis, ulnar head of pronator teres, very rarely ulnar head of flexure pollicis longus. The medial surface gives attachment to flexure digitorum profundus. Upper part of the lateral surface presents a notch that is known as the radial notch, and head of the radius is articulated over. Here I am having the radius, and this is the head of the radius. So this is how the head of the radius is articulated over here, and head of the radius is kept in place by a ligament called annular ligament. So annular ligament arises from the anterior margin of the radial notch. It encircles the head of the radius and goes to the posterior part. Okay, the lower part of the lateral surface, there is a depressed area that is known as a supinator fossa. The supinator fossa accommodates the radial tuberosity. You can see when the head of the radial is articulated, here below there is a radial tuberosity. To accommodate the radial tuberosity, there is a depression that is known as the supinator fossa. Now, this is supinator fossa. Supinator fossa is limited posteriorly by a crest. Okay, so this crest is known as the supinator crest. So D part of supinator muscle takes origin from the supinator crest. Now see the lower end. Lower end of the ulna has got a head. This is the head of the, and there is a small styloid process. Head of the ulna is articulated with the ulnar notch of radius to form the inferior radio-ulnar joint, Whereas here, head of the radius is articulated with the radial notch of ulna to form the superior radio-ulnar joint. Apex of the styloid process gives attachment to medial or ulnar collateral ligament of wrist joint. So this is how the head of the radius is articulated with the ulnar notch to form the inferior radio-ulnar joint. The tip of the styloid process gives attachment to a structure that is known as the articular disc. Inferior surface of the lower end of radius is articulated with the two bones. We have the scaphoid laterally and we have the lunate. Okay, no carpal bone is articulated with the head of the ulna. The reason is from this styloid process there arises a structure called articular disc which is attached in this way. So which separates the carpal bone from the head of the ulna. Tendon of extensor carpi ulnaris muscle is passing through this groove between the head of the ulna and the styloid process.